Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor, and this is a video about whether we always need to treat mycoplasma if it tests positive or for patients having issues with mycoplasma. So someone had asked this question based on one of my other videos, and it's a really good question. Mycoplasma is a little bit unique. Mycoplasma for a lot of folks doesn't really cause any particular symptoms. Some people it will cause what they refer to as walking pneumonia, which is sort of this annoying, persistent, sort of like mild to moderate grade pneumonia that just kind of persists and persists. And then for some folks, it seems to be a really important co-infection of Borrelia burgdorferi, also known as the bacteria that causes Lyme disease, or in some cases, persisting borreliosis, or like chronic Lyme disease, as some people like to call it. So it's a really good question. I feel like in my world where I have I almost want to say the luxury of pretty much being unable to access pharmaceuticals to treat my patients dealing with chronic infections, because where I practice, I'm in beautiful Nova Scotia up in Canada, there are virtually no medical doctors who will prescribe those pharmaceuticals for patients, and the scope of practice in Nova Scotia for naturopathic doctors like myself is such that we're not able to prescribe pharmaceutical drugs here yet. One day we might, but right now that's not an option. And so what we're left with is using herbs and IV therapies and maybe certain nutraceuticals and things like that when we want to actually kill microbes. And so one of the advantages of being stuck with those as the only options, and I really say stuck in quotes because little gap in the video there. It's the first time of every video I've ever recorded in my office, the first time somebody's knocked on my door mid-video. Let's see here. So I say the point I'm ultimately was trying to drive at is that I don't really look at it as a disadvantage that we, quote unquote, only have herbs, because I find that they work very, very well in my practice. I've really, on only very rare occasion, been sad to not be able to have, and then my low battery pops up. So not the smoothest video, but that's okay. This is very real. No editing, obviously, with my videos. So it's been very, very rare that I've thought to myself, by golly, like my patients are, not getting the best treatment experience possible because I can't access those pharmaceuticals. So anyways, side point, I think that it's one of the advantages of only having herbs as an option is that herbs have a broad spectrum of activity. So if I have a patient where I think to myself, I think they have persistent borreliosis, or I think they have chronic viral infections, I can't pick an herb that doesn't possibly have some anti-mycoplasma effect as well. So there's just this broad spectrum treatment that happens when we're working with herbs, and the way I typically recommend them is using combination formulas that have several different herbs in them. As I've mentioned in many other videos in the past, I'm a big fan and proponent of the work of Stephen Buhner, who's a brilliant herbalist and has written definitive books on Lyme and co-infections, not only their herbal treatment but also just the way that they affect the body, and they're detailed compendiums of everything one would want to know about these microorganisms. So I think that in my practice, is if I'm using herbal formulas, I am going after mycoplasma whether I want to or not, whether it's there or not. And so I think it's something that I'm just treating by default anyways. Now with that being said, going after microbes with antimicrobial methods and treatments, herbal, IV, etc., that's not necessarily going to address every issue that someone has with that microorganism. So I guess the other half of my answer to this question, which the first answer is like I'm just default treating mycoplasma if I'm treating patients for systemic microbial infections anyways, the other half of my answer, which is a little bit more specific to mycoplasma, would be in the world of low-dose immunotherapy, or LDI, which I've posted many videos about up to this point. And so I recommend checking that out if you haven't heard of it before. But one of the really interesting things, one of the many fascinating things with low-dose immunotherapy is that we have specific formulas for the various microbes in question. So I've had many patients over the years where I've treated them with herbs and different implementations, supporting their mitochondria, detoxifying, the whole 9 yards, and they still have symptoms. And then we get into low-dose immunotherapy, and sometimes we start with low-dose immunotherapy much sooner than like we've thrown everything at you and let's fall back on low-dose immunotherapy. Sometimes LDI is the first line therapy or the second thing that we bring into the mix once we have the herbs in place. But I've had patients where, at some stage along the way, I think to myself, I think we need to work with some low-dose immunotherapy, and then I would give them, say, the formula that's for Borrelia hypersensitivity, and maybe there's no response to that. We try Bartonella, there's no response to that. We try Mycoplasma, there's a response. The patient's feeling better. It helps to address their fatigue or their brain fog or migrating joint pain or whatever it is that's still residual with their case. And so in that case, I feel highly confident that I am addressing a Mycoplasma-related issue very specifically there. So, I would say from that perspective, in a number of the cases that I've treated, excuse me, specifically going after Mycoplasma is very important for some people. Now, compared to other LDI formulas for, say, Borrelia and Bartonella, Babesia, yeast, strep, food sensitivity triggers, environmental allergen triggers, compared to some of those much more common formulas, Mycoplasma is not, it doesn't get to play with, it doesn't fit in the same category as those more common agents that are helpful. Estrogen would be another one that should be, deserves honorable mention for that list. I'd put Mycoplasma probably in more like the second tier category. So if I've run through those formulas and we still haven't hit all the nails on the head, the Mycoplasma would definitely be in my next set of antigens to consider looking at with low-dose immunotherapy. And oftentimes I'll actually put Mycoplasma in with some of the other micros. One of the nice things with LDI, it's very versatile. So for some patients, I might do a combination of Borrelia, Bartonella, Babesia, and Mycoplasma all together. And then if the patient's responding to that formula in combination, beautiful. Sometimes we need to split those combo formulas up, and we'll see like, oh, it was actually the Borrelia and the Bartonella that was helping. Mycoplasma and Babesia didn't really do anything. So Mycoplasma is not the most common LDI antigen, but it's definitely one that comes up on a quasi-regular basis. So I hope that answered the question, and it was a good question. If there's any other questions about this topic or anything else, just post them in the comment section below, and otherwise I will leave it there.